Having a healthy bowel movement is an important part to everybody's life. In our fast paced society, I know it can be challenging to get the right amount of healthy food options, fiber, and water to form a nice, soft, bulky bowel movement. In our stressful lives, it can also result in us deferring bowel movements to later in the day, which can often add to constipation, straining, and difficulty going to the bathroom. When you have a bowel movement, you sit on the toilet. The body relaxes, the pelvic floor relaxes, the anus drops down, and the anal canal opens up so the bowel movement occurs. Any change to these actions, in a combination with hard stools, can result in constipation and various pelvic floor and anal rectal conditions. Hard bowel movements can often form an anal fissure, which is a tear in the anal canal. As you can see in this model in the rectum, when you're looking at the anus, you can see a big tear in the back part of the anus. What that does is it creates a break in the mucosal lining down to the muscles. So every time you go to the bathroom, these muscles here in your anus spasm, resulting in this area of tear and tissue not being able to heal properly. There's certain things you can do to help with these fissures. You can start with taking fiber and creating a softer bowel movement. I generally recommend Miralax as well if you need a gentle laxative to help going to the bathroom. In addition to fiber and dietary modifications, I recommend only going to the bathroom when you need to. Get on the toilet and get off the toilet. The more time you spend on there, the more pressure that's put on the anus that can result in more pain afterwards. Warm soaks in the bathtub can also help a lot too. If those don't help, there's a various number of medical options as well. I often prescribe a topical medication that provides some muscle relaxants to the anal muscle that you can apply yourself a couple times a day. If that doesn't work, there's other surgical options that are available to you as well. Sometimes we'll take Botox injections, similar to Botox that you put in your face, and that can be inserted right here into the anal sphincter muscles. That provides some chemical relaxation to the muscles in efforts to help that fissure heal. Finally, if that still doesn't work, there are some additional surgical options where we can release some of the muscle to help that fissure heal. Most of the time, these fissures will heal with conservative measures and some simple basic medications. I'm here and happy to help treat these fissures for you, as I know they can be extremely problematic and certainly interfere with the quality of your everyday life.